Patient education is important when using oral stents. Patients who tolerate the device well understand that head and neck radiation treatment will be challenging. They desire to cooperate with the treatment plan and want to protect their oral structures if informed of the benefit. To help achieve patient adherence and motivation, include the patient in the fitting process from the beginning. The GrayDuck dart comes in one universal size. During fitting, the GrayDuck dart requires a bite opening of at least 20 millimeters, or 3/4 of an inch between top and bottom front teeth. A bite opening of 25 millimeters or 1 inch is required when one spacer is added to the arch tray. A bite opening of 30 millimeters or 1 3/16 inch is required when 2 spacers are added to the arch tray. A patient should have at least a few lower teeth to anchor the stent and allow the stent to be repositioned between treatments in the same position. For many patients, having their tongue touched is uncomfortable and can induce a gag reflex that slows the fitting of the stent. With time and practice, patients will overcome these reactions to the stent in their mouth. Begin by speaking with the patient about the pros and cons of using the GrayDuck dart. If the patient feels rushed during this discussion, it could slow the overall fitting process and device acceptance. The goal of using the device is that the stent will place the jaw, teeth, and tongue in the same reproducible position from the first treatment session to the last treatment session. Explain to the patient the benefits of tissue sparing, reduction of mucosal ulceration and pain, taste bud preservation, and salivary gland function. This explanation only takes a few minutes for the patient to realize the benefits and improve overall compliance during treatment. Explain the fitting process and how the patient will be positioned during treatment. Talk about the stabilizing paddle of the GrayDuck dart that will touch the patient's tongue. Discuss the forward tongue thrust position that's achieved by resting the tongue forward when wearing the device during treatment. Inform the patient that the tongue position should be comfortable and repeatable. Explain that the device can feel warm or even hot on their lips before being placed in their mouth after stent insert material is softened in hot water. Typically, patients tolerate the heated material well, which cools rapidly to form a dental impression. For additional information, please contact your local CQ medical representative or visit us at www.cqmedical.com.